I'd like to call the House Health Full Committee to order. Will the clerk please take the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall,
Here.
Helton, Kumar, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. And before we get started with the agenda today, do we have any members that have any personal orders? Okay, Leader Gant, you recognized?
Mr. Chairman, this may be out of normal protocol, but the West Tennessee and Middle Tennessee weather outlook is not looking too good. I know a lot of us have family members back home, constituents. And if you don't mind, if we go out of order, and I'm going to ask Representative Paul Sherrill to say a quick prayer, if you don't mind.
Without objection, Representative Sherrill, you're recognized.
Thank you, Chairman. If you have a hat on, would you mind removing it as we pray, please? Thank you. Our Father in heaven, God, we humbly bow before you. We come to you, God in heaven, our Father, at this time through your Son, Jesus Christ. We ask these things in Jesus Christ's name according to your will. We do try to humbly bow before you and pray and ask forgiveness, God, where we sin, fail, and do wrong in our lives. We thank you and praise you so much for forgiving us. God, as we come together here, probably a very unusual time to do this, but we know that, God, you're God of the universe, and we know that, God, you're in control. We hear of a lot of bad weather coming through, storms and things coming through in Tennessee and other places in the United States. And we just pray and ask, God, for your help in people's lives, that, God, you just help us all to look to you. We just pray now you'll continue to go with us and guide and direct us, continue up to have a safe day and a safe night. In Jesus Christ's name we ask. Amen.
Amen.
Thank you.
All right. Representative Whitson, you're recognized.
Thank you, Mr. Chairman. I'd just like to recognize there's a bunch of ladies here from Williamson County today. I asked them to stand, and they're down here advocating for what we do in democracy and letting their representatives and their people know. Would they please stand? There you go. There they are. Thank you very much.
Yeah, thank you for joining us. Okay, seeing no further personal orders, I've got a little housekeeping to do on the calendar. So item number 2, House Bill 2162 has been taken off notice. Item number 14, House Bill 2032, rolled to the hill of calendar. Item number 15, House Bill 946, rolled to the hill of the calendar. Item number 6, House Bill 2779 will be rolled to the hill of the calendar. Item number 7, House Bill 2778 will be rolled to the hill of the calendar. And item number 9, House Bill 2535 will be rolled to the hill of the calendar. So without objection, that brings us to item number 1, House Bill 2096. Leader Lamberth, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. And just beforehand, we were comparing the two amendments, and I had indicated that we might go with 16787. I actually think Amendment Code 16623 will accomplish our goals better. And if I could present that to the committee, Mr. Chairman, and then explain why.
Okay. Need a motion on that amendment. Amendment 01, you have a motion second on Amendment 016623. You are recognized on that amendment.
Thank you, Mr. Chairman. And members, the goal of this is that years ago, for these type of programs that give temporary assistance to individuals, that the federal government gave the state the ability to say that if you are able-bodied and you can work or go through work training, then you should be doing so if you're taking advantage of, again, these short-term benefit programs. And the goal for all of these programs is to help folks short-term to get back on their feet and then get back up to the part, to a time in their life when they would no longer need these programs. So the intent of the bill, if Amendment Coded 16623 goes on, is we would not grant any waivers to that except for what the commissioner currently has the authority to be able to do. And part 1 of this would say if there are any waivers, and these are very, very rarely used, but there are some nuanced circumstances where it would be necessary. If there are any waivers, those would need to be reported back to us. And so I trust the commissioner. They seem to be doing a very good job with this, but there's just nothing in the statute that actually controls for that to say, look, if you're working, you should be. And by the way, if you do any waivers, then you should just reporting those back.
All righty. So we have questions for the sponsor of the amendment. Representative Clemens, you're recognized.
Thank you, Mr. Chairman, and thank you, sponsor. My question is on the last page of that amendment in subsection B. It says the department shall not exercise the state's option to provide an exemption from the work requirement under the federal code. What type of exemptions could the department currently exercise?
You're recognized.
So, and you and I always get deep in the weeds, and I appreciate it. So there's a distinction between exemption and waiver, apparently. And what we're talking about are exemptions here, where if, say, in an area, it's literally a tornado hits, a natural disaster hits, and it's impossible for someone to be able to work or go through work requirements, then obviously that would be a situation where a waiver potentially be appropriate. An exemption is more broad, where like there would be an exemption, say, statewide. So those waivers that are one-offs, we want them to still be able to do. So if you have a unique circumstance, say you have someone in an area where literally there are just no jobs available. I mean, where there's just nothing. And that is a provable fact. Then we want the commissioner to have that type of flexibility, but not to do just a full exemption.
Representative Clemens, you're recognized.
Yeah, thank you. And I appreciate that distinction. And I guess that's where my concern lies, is the taking away the flexibility of the department to make a judgment call there and provide exemptions from that work requirement to accommodate different circumstances that may be affecting the entire state or an entire piece of our population. So I appreciate the response. And thank you, Mr. Chairman.
Thank you. You're recognized.
Thank you, Mr. Chairman. And again, in subsection A, the intent is that they would still be able to exercise the waivers, just not a full exemption as in reference in B. That's the intent of this.
All right. Any further questions on the amendment? Okay. Seeing none, we are voting on amendment 016623. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. Any further questions for the sponsor of the bill? Seeing none, we are voting on House Bill 2096. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman and members of the committee.
All right, thank you. So item number 2 is off notice, so that brings us to item number 3. There you go. Yeah. House Bill 2416 by Chairman Moody. You are recognized. You have a motion and a second.
Thank you very much, committee and Mr. Chairman. May I take just a moment to introduce? I have a student with Eagle Forum shadowing me today,
Absolutely.
Kaya Shepherd. She is from Clinton, Tennessee. And if you'll just wave at everybody for me.
Good deal. Thank you for joining us. Now, you have an amendment on this, 015315, is that correct?
Correct.
Okay, can I get a motion? You have a motion, a second on the amendment. Do you want us to go ahead and put that on?
Yes.
Okay,
please.
without objection, let's vote on amendment 015315. All those in favor say aye. Opposed? Ayes have it. We are back on the bills amended. You are recognized.
Thank you so much. And members, in Tennessee, we already, it is against the law to do a telehealth chemical abortion. So we realized there was not a penalty with this. So what this does, it will create a Class E felony, and it will provide a basis for a civil malpractice action. And that's all we're doing, is adding a penalty.
All right, any questions for the sponsor of the bill? Okay, Representative Clemens, you're recognized.
Thank you. I'm sorry I missed that. Can you explain exactly what this bill does?
We're adding a penalty if a doctor in Tennessee does a telehealth chemical abortion.
You're recognized.
You're saying they can't prescribe one via telehealth or following a telehealth visit?
They
You're
can't do
recognized.
the chemical abortion through telehealth.
You're recognized.
Thank you, Mr.
Okay, any further questions on the bill? Okay, seeing none, we are voting on House Bill 2416. All those in favor say aye. Aye. Opposed?
No.
Ayes have it. Bill goes on to government operations.
Thank you.
If you would like to be recorded as a no, please tell the clerk. That brings us to item number 4, House Bill 2746. Okay, you have a motion on the bill. You are recognized. There is an amendment 014995. Is that correct?
Correct, thank you.
Okay, I need a motion. You have a motion and a second on your amendment. Do you want us to go ahead and put that on?
Oh, yes, please.
Okay, without objection, let's vote on amendment 014995. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bills amended. You are recognized.
Thank you, Mr. Chairman and committee, for putting the amendment on the bill. It was actually Senator Reeves, and he's a pharmacist. He helped draft the amendment. And the bill has passed the Senate Health Committee, and it's referred to Senate calendar. According to an article in Becker's Hospital Review, as of March 11th of this year, there are 28 states with legislation to promote ivermectin access, and that's what this bill is. It's an ivermectin access bill. Last week in subcommittee, we brought up New Hampshire, and the bill in New Hampshire actually allows pharmacists to dispense the ivermectin by standing order, and the bill has passed the New Hampshire House. This bill, as written and amended, allows a pharmacist to provide ivermectin to a patient who is at least 18 years old pursuant to a collective pharmacy practice agreement containing a non-patient specific prescriptive order developed and executed by one or more authorized prescribers. This means that doctors will develop the proper guidance procedures, such as the proper dosage and contraindications, and everything needed for pharmacists to responsibly dispense ivermectin to individuals without a prescription, but still have proper measures of a prescriptive order. The bill requires the Board of Pharmacy to establish procedures for providing patients with a screening risk assessment tool, providing standardized fact sheet, and providing either ivermectin or referral to a pharmacy that dispenses ivermectin. This bill does not require a pharmacist to dispense ivermectin. The bill includes that a pharmacist or prescriber acting in good faith is immune from disciplinary actions or civil liability. Ivermectin was first licensed for human use in 1987, and in 2015, its inventors actually won a Nobel Prize for saving so many human lives around the world. As of today, there were 154 published articles on ivermectin studies, and 105 of them are peer-reviewed studies. Ivermectin has been officially adopted for early treatment in all or part of 22 countries. Scientists have discovered that ivermectin has at least 5 mechanisms of action that work against the SARS-CoV-2 virus and other viruses. It has been deemed one of the safest drugs ever invented on the World Health Organization's list of essential medicines. And in order to get a clearer and unbiased understanding of ivermectin safety, we can look to studies published prior to COVID. And one such study, a 2016 study in the Journal of Drugs and Dermatology titled Over 25 Years of Clinical Experience with Ivermectin, an overview of safety for an increasing number of indications. The authors found that there are negligible adverse reactions in humans. Not a single death directly was related to ivermectin. The limited number of severe adverse events were found to be from dying off of targeted parasites, not from the ivermectin itself. It has a robust safety profile and can even be used on children and neonates. And ivermectin is a highly anti-inflammatory drug, making it potentially very useful for many other medical indications. With that, Mr. Chairman and committee, I thank you for hearing this bill, and I hope that you will pass this bill so that the next COVID round that is coming, Tennesseans can be better prepared and well able to use this for early treatment, because that is what ivermectin is most effective for, is early treatment. And Mr. Chairman, I do have a couple of folks here to testify if needed. It's
Wait, the question's been called. Is there any objection? You object? There's objection. Would you withdraw? Would you? No? Okay. All right. Vote. All right. All right, question has been called. All those Voting on previous questions, say aye. Aye. Opposed? Ayes have it. We are voting on the bill. All those in favor of voting of House Bill 2746 as amended, say aye. Aye. Opposed?
No.
Ayes have it. Bill goes to Calendar and Rules. If you would like to be recorded as a no, please tell the clerk.
Thank you, Mr. Chairman and committee.
Thank you. All right, that brings us to item number 5, House Bill 960. You have a motion, a second?
Thank you.
You are recognized, and there is an amendment. 14051, is that correct?
I believe that's correct, Chairman.
Okay. Would you like us to put
Please.
that? Okay, without objection, let's vote on amendment 14051. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized. You're recognized.
Thank you, Mr. Chairman. 2 years ago, in the last session, I brought this bill, and your committee was overjoyed and leaped for joy, and after much discussion, passed it. Somehow, in the interim, when we had the special session, this bill got lumped in with the omnibus bill, all dealt with COVID, and it ended up with a sunset hanging on it, which was never the intent when we passed the bill. So all this bill now does is pull the sunset off of it that wasn't supposed to be there in the first place. So.
All right, questions been called. Without objection, we are voting on House Bill 1960 as amended. All those in favor say aye. Aye. Opposed?
No.
Ayes have it. Bill goes to Calendar and Rules. If you'd like your vote to be recorded, please tell the clerk.
Thank you, committee and Mr. Chairman.
Thank you. Okay. So that brings us to item number 8, House Bill 2545, and Chairlady Helton be presenting that. You have a motion second. You are recognized.
Thank you, Mr. Chairman. I do have an amendment, and it rewrites the bill.
Okay. And which amendment are we going with?
016580.
Okay. You have a motion second on 016580. Okay. Would you like us to put that on the bill?
Please.
Okay. Without objection, we're voting on amendment 016580. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Tennessee has had a certified medication aid program for more than a decade, and this program is a career ladder step for certified nursing aides. This bill, as amended, allows remote learning through virtual program platforms that provide flexibility for instructors and candidate participation. It allows CNAs with a year of continuous work experience and a letter of recommendation from their director of nursing to take the class. Current rule requires a CNA to have 1 year of experience in no more than 2 buildings. It adds certified occupational therapy assistants as a qualified candidate for the course. It changes the exam passing grade from 85 to 75%, which aligns with the certified nursing assistant test passage requirement, and it authorizes the Board of Nursing to promulgate rules as needed.
All right. Any questions for the sponsor of the bill? Okay. Seeing none, we are voting on House Bill 2545. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman and committee.
Thank you. That brings us to item number 10, House Bill 1747. Chairman Jernigan, you're recognized.
Thank you, Chairman.
You have a second.
Members, House Bill 1747 adds quadriplegia to the list of medical conditions listed in TCA 17402, in which a diagnosed person is authorized to lawfully possess cannabis oil. Adding quadriplegia to the list could help with the most common side effects of living with quadriplegia, which more commonly are muscle spasms, overactive bladders, and insomnia. I live with quadriplegia every day, and muscle spasms, especially at night for me, can become unbearable, and it does lead to insomnia, even the medication I currently take. And I'm asking the committee for some relief for Tennesseans with quadriplegia to be added for the list for the commissions to look at. So with that, I'll take some questions, Mr. Chairman. Okay.
Question's been called? Withdrawn? Okay, that has been withdrawn. Chairman Kumar, you recognize?
Mr. Chairman, I just wanted to clarify that quadriplegia means paralysis of all four extremities. Paraplegia means paralysis of lower extremities.
But-
I think you applied it to
Yes.
yourself. I don't think that applies.
Yeah, so and I can tell you the difference between, if you break your back, you're a paraplegic. If you break your neck, you're a quadriplegic because it affects all four limbs when you go above the cervical area of the neck.
Thank you.
You're welcome.
Thank you,
you.
Mr. Chairman.
Okay, any further questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 1747. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to criminal justice.
Thank you, Mr. Chairman, members.
Thank you. That brings us to item number 11, and I do not see Representative McKenzie, so I will, oh, there it is, okay. You are recognized on House Bill 2559.
Thank you.
Yeah, you have motion second. Yeah, you're recognized.
Oh, thank you, and I apologize for that. Thank you, Mr. Chair. This bill does one thing and one thing simply. It asks for data, and that's all it does. Gun violence is a problem. It's a problem in my community. You heard last year. Continues to be a problem statewide, urban and rural. All this bill does is seeks to find an answer. It asks for the data on gun violence and how it's affecting our community. With that, I ask for your approval.
Okay, Representative Byrd, you recognize?
Thank you, Mr. Chairman. The one concern that I have is why the Department of Health? Because they're definitely not, they're no experts on gun safety, and if they do the reports, then why would we want them to make an evaluation and thoughts on how to curb gun violence?
Thank you, and thank you for the question. I really think the Department of Health is the perfect entity to do it because they're separated. Again, I know some people probably gotten emails on this bill being about the gun or about the ownership, and it's not that. It's about the health effects. What's happening after that incident happened? As you know, I had 5 students. My high school, 700 students, my alma mater, suffered from gun violence on last year from January through April. What's happened with those families? Well, what's happened with the mothers and the fathers? It really is strictly about the health effects of this happening. If there was a cancer cluster in a community, that's what they would do. Look at it from a scientific, epidemiological kind of a way. So it's trying to take it away from those polarizing aspects and what are the health effects of that. So thank you for that question.
Representative Byrd.
Well, and I can understand the reports, but I don't quite understand how they would be able to be in a situation to give you a recommendation on how to stop the violence or how to reduce the violence. Because I don't think they have the manpower for one thing, and I don't think they have the expertise for another. So that's my concern over the bill. Thank you.
You recognize?
Thank you, and that's exactly right. We're not asking them to solve the problem. We're asking them to paint the picture for us. That they can do. They can say from a health standpoint what can happen with this. We're not asking them to take away anything, to add anything. It's strictly to give us the data.
Leader Gant, you're recognized.
Thank you, Chairman. Good afternoon to the representative from Knoxville. Can you drill down into this and give us the specific method that the department would use? How would they correlate getting the numbers? Where would those numbers come from? What bureaucratic process would that entail for that to happen?
You're recognized.
Thank you. I can give it a good overview of what an epidemiologist would do. They would take that gun violence, that gun death or injury, and start to peel back what's happened. If it happened 5 years ago to a 26-year-old that had 2 kids, what's happened to those 2 kids? Are they in foster care? Was it the grandparent that took them up? How are they doing socially? If it just happened to a child, how are the parents coping with this? Are they engaged? Or are they working? Again, this is about the health effects. What's happened to our family structure after this tragic event happened? So that, again, it's a scientific approach. So it's not about the event so much as the results of that. What kind of holes remain?
You're recognized.
Thank you, Chairman. So what would be the specific steps? I guess that's where I'm having trouble. There's got to be something built into this legislation that gives specific direction on how we arrive at those statistics and the information that you're wanting to come back out of this legislation to the department to give you the information you've got described here. So,
you're recognized.
Well, thank you. Thank you, Mr. Chair. So again, it's asking the department to take a look at what's happened from a standpoint. Sally Sue was murdered, and she was a mother of 2. The 2 kids went into some kind of interventions, maybe state-run, maybe private, and then you got Johnny over here that happened. They went into different programs, and 5 years later, these 2 programs were very effective. This one that this person went into, this child went into, wasn't. So it'll rack and stack all of the things that happen. We don't know what's happening right now. We don't know what's going on. Again, if it was something from a medicinal standpoint, you would know, or you would be learning that. This puts it into that. This is the best way to get it into the right field. I think from the violence standpoint, there's some I won't call it an epidemic, but there's some epidemiological things that we can take and use and see what these interventions look like, see what the results are.
Leader, you're recognized.
So would they derive this information from hospitals, law enforcement? I'm still having trouble connecting the dots on who's responsible for what in deriving this information that you're asking for.
You're recognized.
Thank you. So there would be a person that we've had 20 that happen this year. Okay. So they would start with person 1, event 1, death 1, shooting 1, and say, where are they? And again, I'm not going to prescribe to them to go back, whether it's 3 years or 5 years, but that data's out there. We've just not correlated it or collected it with this lens on. So if it happened 3 years ago, what's happened to them? You can talk to the health department to see what's going on. You can talk with the social service agencies, talk to law enforcement to see if there's a unfortunate outcome that a child may have gotten into trouble. So this child ended up a pretty good kid before. Now he's incarcerated, or she's incarcerated, or she's in a program, or she's at the University of Tennessee, or he's at the University of Memphis. So taking that data, so that's what this person would do. It would be their job to do that.
Okay, Leader Gant.
Okay, I'm still having trouble understanding the direction of the legislation, and it sounds like it's going to be a burdensome thing for the Department of Health to try to. I know your intention is good. It sounds like it's in the good with good intentions, but I think this creates a bureaucratic nightmare for the Department of Health, and I would encourage my colleagues to vote against this. Thank you, Mr. Chairman.
Thank you. Representative Clemens, you're recognized.
Thank you, Mr. Chairman. I appreciate it. And sponsor, thank you for this vital piece of legislation. I think given the fact that gun violence is a public health crisis, would make the Department of Health the natural department to provide this type of information. The type of things you're discussing in this piece of legislation, including deaths collected by the Department of Health, disabilities information is collected by the Department of Health, gun violence results in trauma. Any gunshot wound is a traumatic event. Department of Health already produces a trauma health report. So I think what you're looking for here, and correct me if I'm wrong, is basically taking all this data that the Department of Health collects, and we often, and I certainly do, push our departments to have some interdepartmental communications and coordination to address crises such as public health crisis. So the Department of Mental Health has data on mental health, and mental health issues are a direct result of gun violence. And so all this stuff's coordinated. So I would think the Department of Health is the natural body to not only, I don't think you're asking them necessarily to collect new data. It's just take all the data and gather it in an interdepartmental fashion and provide it to this body so that we can make informed decisions moving forward. And I think that's a great idea. That's a smart idea. And I think we rely on that type of data, or should, to make data-informed decisions and scientific-based decisions when we form policy up here. You know, anything from blood banks. The Department of Health collects information on blood banks. And when you have gun violence, you rely on blood banks. And so if there's a shortage in blood, the Department of Health has that knowledge and has that information and that data. So all of this stuff is naturally flowing through the Department of Health and should be coordinated in an intergovernmental manner to provide us with the data and research that we should necessarily rely upon in forming policy. And so I think that's the aim of your legislation. And feel free to correct me if I'm wrong or if I've said anything off base, but I support the legislation. It seems to me that's what you're trying to do. And please, again, correct me if I'm wrong. Thanks.
You're recognized.
Thank you. And thank you for that. And thank you for putting it in that way. So in terms of what would be new for the health department, it's that crosstalk conversation that someone who's solely focused on doing this for a data gathering situation would be. So thank you for that.
Representative or Chairman Williams, you're recognized.
Thank you. Does the TBI not already do a crime report as it relates and includes issues surrounding gun violence? I'm relatively certain I see that they do an annual report that talks about crime in every aspect across the state.
You're recognized.
So if you look at the report, yeah, it talks about it from a pretty much a numbers standpoint, of the types of people that are committing crime, race, and things of that nature. But it doesn't talk about it from the health effects of that gun violence. It's more of just a rack and stack. We had 20 this year and 30 the year before.
So
you're recognized. Thank
you, Chairman. And so your bill says that it terminates in July 1st of 2024. One of my colleagues stated that there was a health crisis as it relates to gun violence. I didn't know that there would want to be. Is that when we expect the end to be, or is that what's the reason for the termination date of the 2024?
You recognize.
To determine its effectiveness. No, there's nothing magic going to happen. I wish. If it does, I'll come back and see you. But I don't expect anything magic to happen in 2024. But what that time period does, it allows the department to see, is this effective? I don't want to pass a piece of legislation for the sake of passing a piece of legislation. But I firmly believe that when we get the data, when we get this crosstalk happening, we can see trends and we can send that on and have folks hopefully help the flow of those.
You recognize.
I noticed in the definition, it says that you're going to deal with economic hardships. My assumption is that's a different department, maybe economic community development. You have disabilities, which would be a different department. Mental health would be a different department. How does your bill make sure these other applicable departments are reporting the data so that the Department of Health can assimilate it all? I guess including the TBI report.
You recognize.
It's my hope. My father worked for the department, what's called the Welfare Department now, Department of Human Services, for over 35 years. And he dealt with other departments. So there was a cross conversation. Hey, I have a patient or a client that I visited that looks like they have some health issues associated with them. So it's my thought, hopefully not dream, that our departments are already in communication across the state, where they're all state employees. So if they have to reach across the aisle to another department, I don't see that as a hindrance. I don't see the state as being totally stovepiped in that regard.
You recognize.
Well, I think part of the reason, unfortunately, that we have to come up here is we have to codify things in order to make sure that departments sometimes talk to each other. I appreciate your father's service and to the state, but I do have concerns that, albeit the ideas is really important to you, I'm just not certain how the mechanism can actually work to put all these applicable departments together. Thank you for answering my questions.
All right, thank you. Chairman Kumar.
Thank you, Mr. Chairman. Thank you, Representative McKenzie. I'm not sure about which department is qualified, but I do like your point about looking at the consequences of violence and injury and what happened as a result to that family and to the children. Which situations did they do better in and which they did not? I have not researched it to know if that data is already available, but I think that to me seems to be the most consequential and potentially useful. Thank you. Thank you, Mr. Chairman.
All right, thank you. Representative Mitchell.
Yeah, thank you, Mr. Chairman. And, like so many other representatives have said before, the data is there. The economic hardships, that would be labor and workforce development. How many of these people are now drawing unemployment? They've lost their job or something, so all the data is there. I think, as you've stated, you're just asking the Department of Health, let's accumulate all this data together and put it in one report. I don't think anyone on this committee should be scared of knowledge. Knowledge is power. Knowledge helps us make good decisions, and to get more information is never a bad thing. So I support your bill.
Thank you. Chairman Jernigan.
Thank you. We'll call the question.
All right. Question has been called. Without objection, we'll be voting on House Bill 2599. All those in favor say aye.
Aye.
Opposed?
No.
Clerk, take the roll.
Representative Alexander. Representative Boyd.
No.
Boyd votes no. Byrd.
No.
Byrd votes no. Clemens.
Yes.
Clemens votes aye. Freeman. Freeman votes aye. Gant.
No.
Gant votes no. Hakeem. Hakeem votes aye. Hall.
No.
Hall votes no. Helton.
No.
Helton votes no. Hicks.
No.
Hicks votes no. Jernigan. Jernigan votes aye. Kumar. Kumar votes aye. Leatherwood. Marsh.
No.
Marsh votes no. Mitchell.
Aye.
Mitchell votes aye. Ramsey. Ramsey votes aye. Cheryl.
No.
Cheryl votes no. Vaughn.
No.
Oh, thank you. Vaughn votes no. Whitson. Williams? No. William votes no. Vice Chairman Leatherwood?
No.
Leatherwood votes no. Chairman Terry?
No.
Terry votes no. Mr. Chairman, you have 7 ayes and 12 noes.
Bill fails. Bill fails. Thank you. That brings us to item number 12, House Bill 2220. You have a motion and a second. And there, I believe you have an amendment for that bill, Amendment 014196. Is that correct?
Correct,
You have
Mr.
a
Chairman.
motion and a second. It rewrites the bill. Would you like us to go ahead and put that on for
If
discussion?
you don't
Okay.
mind,
Without
Mr. Chairman.
objection, let's vote on Amendment 014196. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. What this bill does is if a veteran's family presents a disability determination to the person signing a death certificate of a loved one, they will have to use that to determine the cause of death. And so really what this is think of a veteran as an example, a veteran that served in Iraq and dealt with burn pits and got COPD and then came back here and then got COVID-19 and died. If the person signed that death certificate didn't know that person that veteran ever had COPD, they may just put COVID-19 on that death certificate, and then the family would never get the veteran's survival benefits. So had that person signed the death certificate known that the person had COPD, that would have potentially been a underlining cause of death. So with that, I'll be glad to answer any questions.
Any questions for the sponsor of the bill? Okay, seeing none, we will be voting. Oh, Leader Gant, you're recognized.
Thank you, Mr. Chairman. I was just going to thank the sponsor for bringing this. It's a very good piece of legislation, and thank you for bringing it.
Thank you, Leader.
All right, thank you. And I would like to second those comments as well. So without any objection, we will be voting on House Bill 2220 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Council and Rules. All right, thank you. That brings us to item number 13, House Bill 2109. Representative Love, you are recognized. You have the motion in a second. And and is it? That's traveling from insurance. So the amendment is traveling with it. So you are recognized.
Thank you, Mr. Chairman and committee members. House Bill 2109 is a bill that was actually given to me by now Senator Lamar. She was carrying this legislation. It was very important to her. It's a good piece of legislation. It seeks to help us get a better definition of what doulas are and what they can do in Tennessee. It involves having the Department of Health to collaborate with TennCare to study existing doula certification programs. And this will be, I think, a wonderful way to increase, again, opportunities to increase the health of mothers in our state.
All right. Okay. Question? Did you have? Would you withdraw? Okay, withdraw.
Thank you,
You are
Mr.
recognized.
Chairman.
You are
I'd
recognized.
like to express my appreciation to Leader Love for carrying on this because frankly, you expanded my mind by bringing this bill because I had no idea what a doula was. I am now a Google expert and I'm gonna start, that's gonna be a trivia question for a lot of my friends is, hey, what's a doula? So anyway, thank you for making me a smarter guy today. Well, I don't know about that. You taught me something I didn't know though. Thank you.
Thank you. It's always good to have someone from the District of Champions to support us. We appreciate that.
Thank you. Representative Clements, you're recognized.
Thank you, Mr. Chairman. I'm just worried what Wikipedia told Vaughn that a doula was.
All righty. Seeing no further questions, we are voting on House Bill 2109. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman and committee members.
All right, thank you. Okay, so that item number 14 and 15 had been rolled to the heel, so that brings us to item number 16. House Bill 2272. Chairman Ramsey, you are recognized on House Bill 2272. Yeah, you have a motion second.
I'm sorry, Mr. Chairman, item 14.
No, item number 16.
Oh, okay. Okay, 2272.
Yes, and there's an amendment.
Yes, sir.
015714 that rewrites the bill.
That's correct.
You have a motion second. Without objection, you want us to put that on
Yes,
the bill?
sir.
Okay, without objection, let's vote on amendment 015714. All those in favor say aye. Opposed? Ayes have it. We are back on the bills as amended. You are recognized.
And the drug overdose continues in Tennessee to increase at alarming rates. Deaths are preventable by examining certain cases that we have. We can make some changes that could prevent a great number of fatalities. They climb by about 50% a year. Tennessee's the 40th highest in fatality drug overdoses in the United States. We have 52 overdoses, deaths per 100,000 people per year, and the average in the United States is 30. Per 100,000. So in 2017, drug abuse and overdose cost U.S. $550 billion in health cost and lost productivity. So what this bill does is creates an Overdose Fatality Review Act, creates a framework for establishing county and regional multidisciplinary overdose fatality review teams to examine and understand the circumstances that lead to a fatal overdose so that the policy recommendations and resource allocations can prevent future situations. One example, Maryland did a similar program like this. They found that a predominance of overdoses happened in facilities for residents like hotels and motels. So they actually instituted a program for the staff that taught them how to intervene and use Narcan. So they dropped their fatalities. So with that explanation, I would renew the motion.
Okay. Any questions for the sponsor of the bill? Okay, Chairman Williams.
I had a question. I recently read where a former law enforcement agency determined that they would characterize every overdose death as an accidental death, which would stimulate or require an investigation into that overdose death. Matter of fact, I think that law enforcement agency was up towards yours. Does your bill define that every overdose death would be investigated as if it were one, or would we be collecting data without an actual investigation of the death?
You're recognized.
Yes, sir. Thank you. And a great question. We do not address that in this bill. This is a permissive voluntary program. We have two of these programs in action, one in Davidson and one in Knox County. And so that's where the fiscal note comes from. If other regions, which we're hoping that 5 counties will become a regional program. And what the issue is it's difficult to study these results and statistics because they are protected by HIPAA laws. So what this would do is allow these groups, the overdose fatality review programs, which will hopefully be regional. It allows them to discuss this information in private and make recommendations according to statistics. So there's no mandate about it. It doesn't do anything for law enforcement across the state.
Okay, thank you. Any further questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 2272 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to finance. That
Thank you,
brings
Mr.
us,
Chairman, ladies and gentlemen.
okay, that brings us to item number 17, House Bill 2228. Chairman Ramsey, you are recognized.
Thank you, Mr. Chairman.
You have a motion and a second. And which amendment are we going with
I
here?
think the final amendment that we have is 16756,
Okay.
the most recent.
You have a motion second on 016756. Okay. And that rewrites the bill. Do you want us to go ahead and put that on? Or you want to discuss it
yes,
first?
sir.
Okay. All right. Without objection, let's vote on the amendment 016756. All those in favor say aye. Opposed? Ayes have it. Okay. You are recognized.
Thank you, Mr. Chairman. All of the U.S. is facing a crisis of fatal drug overdoses, and Tennessee, like other states, is having a 50% rise each year. I'd already quoted the other statistics that we have. This bill requires a healthcare prescriber to offer a prescription of opioid antagonist or a similar FDA-approved drug, which I think there are about 6 on the market at the time. They are required to at least offer to a patient who is prescribed an opioid that meets certain criteria, which is more than a 3-day supply of opioid medication. The second criteria, the healthcare provider is giving a co-prescription of benzodiazepine, or the third situation where a patient presents an increased risk of overdose due to history of substance abuse disorder. So what this would do, it excludes individuals whose opioid prescriptions are part of a palliative care treatment or those prescriptions that are written by a veterinarian. So with that explanation and pending questions, sir, I would renew the motion.
Okay. Any questions for the sponsor of the bill? Okay. Seeing none, we are voting on House Bill 2228 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you.
All right. That brings us to item number 18, House Bill 2531. Chairman Ramsey, you're recognized. You have a motion and a second.
Thank you, Mr. Chairman. We are, as well as an opioid overdose crisis, we're in a mental health counselor crisis. 77% of the counties in the U.S. have a severe counselor shortage, and we see each year, it's a very difficult profession. Each year, about 20% of those jobs are vacated. We have made some advances like telehealth, salary increases, license reciprocation. But Marie Williams and the Commissioner of Tennessee Department shows us the desperate need by asking for $70 million going forward, and in the eventuality of $300 million for future programs to help with the counselor shortage. We need to do all we can in that nature. The changes that we are making today in the first section, the bill refines requirements for licensure. It removes required hours, which is in the regulations for the regulatory board, removes qualifications, which are in another section of the chapter. Section 2 of the bill clearly states that a candidate for licensure must have completed supervised field experience. It removes the list of mental health providers because of the list is provided in the regulations of that body. And the term master's degree is changed to postdoctorate degree, extends 1 year for temporary licenses. Right now, it's 3 years or until the board grants or denies a license. So that what this bill does is increase that to a 4th year. With that explanation, pending questions, I will renew the motion.
All right. We have an amendment. I assume that describes the amendment.
I'm
There's
sorry. Yes,
amendment 014047. Is that correct?
It does, sir.
Okay. So you described the amendment. Without objection, let's vote on the amendment. All those in favor say aye. Opposed? Ayes have it. Okay, we're back on the bill as amended. Do we have any questions for the sponsor of the bill? Question has been called. So without objection, we are voting on House Bill 2531 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. All right. Your other two bills had been rolled to the Hill. We will get to those just shortly. We got one other bill, and yeah, so we are on item number 19, House Bill 2641. So I'm going to pass the gavel over to our Vice Chair, Leatherwood.
I'd like to request a roll call vote on this bill.
Three hands, I guess. Good. Okay. I don't know that that counts, but there were three other people with you, so you raised both hands. Okay, Chairman Terry, you're recognized on House Bill 2641. You've got a motion and a second. I believe there's an amendment.
Yes, I have an amendment. This is not the same amendment that came out of subcommittee, but it's 016732.
Okay, you've got a motion and a second on amendment 016732. Do you want to go ahead and put that on?
That'd be fine.
Okay, without objection, we'll be voting on amendment
We have to do roll call. We have to do roll call on that amendment.
Oh, okay, yeah. Well, we will be voting on that amendment 016732. And is this a point of order? Okay, point of order.
If the amendment rewrites the bill, and we're taking a roll call vote, the big challenge you have is it could be misconstrued that you support the bill just to be able to hear the amendment. So I guess the point is would the member who made the motion allow for the amendment to be put on for the purposes of discussion, regardless of a vote, with the roll call vote being on the bill?
I'll discuss the amendment.
Well, you'll withdraw your motion then for.
I'll discuss the amendment before we vote on it.
Okay.
Okay, he does have the right to discuss the amendment before the roll call vote on the amendment. Is that?
Yes.
Okay. You're recognized, Chairman Terry.
Right, thank you. The original bill that was sent and then was based off a framework that the Cannabis Commission sent to me. And I worked within that framework to have an amendment that I presented in subcommittee. Unfortunately, that amendment had a fiscal note that I simply cannot resolve at this time. And so what this amendment does is it essentially does three things and has three goals. One, it adds currently with the bill that we passed last year for the Cannabis Commission, we added 9 conditions that could get the 0.3 THC oil and be decriminalized if they had the letter of attestation. And so I'm simply adding 3 conditions to that. One is trigeminal neuralgia. Currently, there's between, I think, 10 and 15,000 people get that per year. So that maybe roughly is maybe 300 Tennesseans. There is FDA-approved treatment for that, but there's a handful of those that do not respond to that, and it's referred to as the suicide disease. And so I have added them in there. There are studies that show that they could benefit. I've added quadriplegia and paraplegia. Obviously, we've already voted on quadriplegia, paraplegia. They do have a lot of the same issues that quadriplegia has with the spasms and such. And the last that I've put in there is research patients that they're in a research program. The second part of the goal of this, it defines what those clinical research programs are. They've been approved by the Federal Drug Administration that's being conducted with or by funds provided by the NIDA, or they're being conducted by a university, medical school, pharmacy school, or hospital. And then the last thing I've done is it directs the Cannabis Commission, which we've already put in position to increase to determine best ways to increase patient access to clinical research programs. And another one is for medical use of cannabis for chronic pain or intractable pain, to have them study hemp-derived cannabinoids such as delta 8 THC, and again, have them look at creating a fiscally viable patient registry, because the fiscal note that I got, I simply could not resolve. I've worked with, and the Department of Health and Department of Safety are neutral on this amendment. And so with that, I'll be happy to take questions on the amendment.
We did have at least one question on the amendment. If, okay, you would draw that. Okay. Chairman Williams, you're recognized.
Thank you, Chairman Terry. I appreciate your hard work on the subject matter. I'm just trying to catch up to your hours. Section 1 of the bill, you listed 2 conditions. In the third, it doesn't qualify what the conditions are for the clinical research. So for instance, if somebody were studying irritable bowel syndrome and the effects of cannabis on someone who had IBS, would that be an acceptable treatment under the idea of study, or somebody with glaucoma, or someone with PTSD, as long as there was a clinical research project surrounding it?
Chairman Terry to respond.
Thank you. Irritable bowel is already in statute. Yes, if there is the way this would work, the physician, they would have to have a research study that they were their patient was going to enroll into, and then the physician would have to attest that they do have that disease. So whether it's a neuropathy or something along those lines, or it could be glaucoma or something along those lines, as long as they have that particular disease in that research, and it's only the 0.9% oil. And to my knowledge, I don't know how many studies, if many, are out there on just 0.9% oil that many would qualify. And that's why the next section, I have asked them to try to develop ways that we can get more of our patients into research. But it's just 0.9% oil.
Follow up, Chairman Williams.
Yeah, thank you, Chairman and Chairman, Doctor. The in Section 3, it lists those 3 different hemp-driven cannabinoid oils, however you say that. What is the limit as it relates to THC in those? Is there a limit?
Thank you. I'm not sure I get the question.
Well, maybe I can ask it better. So these hemp derivative, you're only adding these 3 additional hemp derivatives to a current list, or these are the ones you're wanting to study? I'm just not picking up on where Section 3 started.
Chairman Terry.
Thank you. All that is that when we set up the Cannabis Commission, we gave them some directions on things for them to study, and this is all they're doing is studying that. This isn't things that we can that we're going to add for people to take.
Thank you, Chairman.
Any other questions of the sponsor on the amendment? Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. Just a clarification, considering the bill that failed in the Senate Judiciary Committee, is this the same bill and the same amendment we're dealing with?
Chairman Terry.
Great question. Yes, it's my understanding that they had a pretty quick finger on the gavel. It's my understanding that they are reconsidering their actions, and it's supposed to be on the calendar for next week.
Follow up, Chairman.
Okay.
Come on.
Secondly, I was concerned that a citizen who wanted to testify on this bill or this amendment was denied testimony because apparently the chairman didn't agree with them. Is that true?
Chairman Terry.
Thank you. There was a person that testified falsely in the subcommittee, and it's to the discretion of the chairman.
Follow up, Chairman Kumar.
I would think that the falsehood in a person who's testifying should be pointed out to them and to other committee members. So the committee members are the ones who make the decision who they want to trust or believe. But I think if a chairman has their own bill and they're going to deny a person to testify against their bill, there's a bit of a problem there. I would like to note that.
And just a little bit of clarification from my part, I think we've gotten on to discussing a Senate bill in the Senate, which I understand could have an impact here, but at any rate, Chairman Terry to respond if you so choose.
I renew my motion.
Okay. Any other questions of the sponsor? And we are on the amendment here, seeing no further questions without, I'm sorry. Chairman Kumar.
I want to reemphasize my concern that we should not be denying a citizen from speaking based on a judgment, and especially it is the chairman's bill and chairman has that authority. I think, I don't know if there's a process to recuse or not. I think that is important. As far as the overall subject matter concerned here, certainly we are a compassionate society. We want to help those with medical illnesses. But introduction of a psychoactive substance into our society does damage the social fabric of our society. Increases availability. Of course, this is a substance plenty available, but it legitimizes availability. And I think there is a problem there when you legitimize it. What are we teaching our children? That we think marijuana is okay. Children will extend and push and go beyond that to a point that they will say, well, it's okay, just as the children have done with alcohol. Well, it's not for minors, right? Vaping, it's not for minors. E-cigarettes, they are not for minors. What has happened? It is plenty available because our children, once again, children that they are, we love them, but they tend to push the envelope and go beyond. And I think that is the problem with legitimizing availability of marijuana. It is also made available for conditions for which there may not be medical evidence, but there is a lot of internet evidence, certainly. And when that happens, it leads to increased usage and usage in inappropriate circumstances. This part is encouraged by the commission, who is intimately connected with the industry. And guess what? Industry wants to sell more. There is a problem there. So other states have done that. They have paid a price in homelessness, DUI, childhood poisonings, especially, increased revenue, but the costs are 4 times the revenue that these states have harvested. Opioid use is down where it is legitimized. Guess what? Heroin use is up. Yes, look at any of these. Marijuana research is not going to Denver and looking at a pot shop. Marijuana research is, come join me and let us go to a recovery court in my community and see how many of these people, how many of these families who have struggled with drugs, it all started with marijuana. Again, availability is there, but we are legitimizing that availability.
We need to stay on the bill.
I thank you for letting me make the statement. I appreciate it. And I think the bill is legitimizing availability, and that's what I was addressing. Thank you, though. I'm done.
Thank you. And Chairman Jordan.
Thank you. And I want to, in response, in a lot of the facts that the chairman just related was a lot of the facts that the witness last week did, which one of the local news stations just blew holes all through the credibility, the misleading facts, the misstatements that were made. And I think that's where we look at the credibility of people to come to speak. And I believe that's when the chairman exercised his right to do that. Well, what some of the same facts that was just mentioned was about recreational, was about smoking, was just nothing. This bill and Chairman Williams is right that we're nowhere near on the bill. So I hope we'd focus back to the intent, what we're trying to do here, and to relieve the pain and suffering of some of those out there that truly need it. Thank you, Chairman.
Thank you.
Renew my motion on the amendment.
Okay. Without objection, we are voting on Amendment 016732. And
Voice.
yes, as I understand, the original motion for a roll call vote was on the final bill and not on this amendment. With that understanding from the person that made the motion and those that second, third, and fourth it, we will proceed with a voice vote on this amendment without objection. Okay. Again, voting on 016732. All those in favor say aye.
Aye.
All those opposed? All right. The amendment goes on the bill. We are now on House Bill 2641 as amended. Chairman Terry, you are recognized.
Renew my motion.
Any questions? Question on the bill without objection. We will be voting on House Bill 2641, and this will be a roll call vote.
Representatives Alexander, Boyd. Boyd votes aye. Byrd. Byrd votes aye. Clemens.
Aye.
Clemens votes aye. Freeman. Freeman votes aye. Gant. Gant votes aye. Hakeem. Hakeem votes aye. Hall. Hall votes aye. Helton.
Aye.
Helton votes aye. Hicks. Hicks votes aye. Jernigan. Jernigan votes aye. Kumar.
No.
Kumar votes no. Marsh.
Aye.
Marsh votes aye. Mitchell.
Aye.
Mitchell votes aye. Ramsey.
Aye.
Ramsey votes aye. Cheryl.
No.
Cheryl votes no. Vaughn.
Aye.
Vaughn votes aye. Whitson.
Aye.
Whitson votes aye. Williams. Williams votes aye. Vice Chairman Leatherwood.
No.
Leatherwood votes no. Chairman Terry.
Aye.
Chairman Terry votes aye. Mr. Chairman, you have 17 ayes, 3 nays.
Thank you very much. House Bill 2641 passes, and the bill moves on to Criminal Justice Committee.
Thank you, Chairman of Committee. All right. That brings us back to item number 14, House Bill 2032. Chairman Ramsey, you're recognized. You have a motion and a second.
Thank you, Mr. Chairman, and I appreciate the motion and second. Just for discussion on this bill, my plan is to take it off notice. I did the folks that sponsored the bill through me, the Tennessee Dental Association, had asked me to read a statement. Dentistry is defined in TCA code as evaluation, diagnosis, prevention, and treatment of non-surgical, surgical or related procedures of disease, disorders, and conditions of the oral cavity, maxillofacial area, or adjacent and associated structures, and their impact on the human body. The CDC for prevention has estimated that 70% of oropharyngeal cancers are linked to HPV, human papillomavirus. Clearly, a preventative measure such as vaccination to prevent oropharyngeal cancer is rational to the practice of dentistry. Empowering dentists to provide HPV vaccinations would provide multiple increased and safe opportunities for an individual to receive those immunizations. Dentists commonly directly deliver dozens of injections per week, often more than their primary care counterparts that they find in primary care offices. The majority of cancers that are found in the dental office as oral cancers or oral pharyngeal cancers. They are typically diagnosed with oral surgeons or pathologists through primary care or surgical offices. I'd like to point out that it was never the intention of this bill, which was actually gave the ability for dentists to give HPV vaccinations. It was never the intention of the Tennessee Dental Association to allow dentists to administer HPV vaccine to children without parental consent. There is a law defining who is allowed to treat the 14 to 17-year-old children without parental consent, and it does not include dentists. It includes primary care, a general array of nurses, advanced practice nurses that have supervision by MDs. But it was never intended, and in code never included dentist. So if you'd like to review video, this bill was heard in the Senate, passed, and the video makes a reference to that. You'd see the lobbyist Mark Green, who addresses the issue and responds to the questions by Senator Hensley regarding whether dentists intended to administrate these vaccines to children. Mr. Green repeatedly said yes, but only with parental consent. There's no place in the law, no place in this bill that actually defied that in any manner. Unfortunately, the bill has been unfairly, I guess, confused with House Bill 946, the next bill we're going to hear. Dentists are not included, nor would they be included in that bill at all. And the definition of healthcare officers and providers per code is limited to physicians. So with that explanation, I'd like to take this bill off notice.
Without objection, House Bill 2032 is off notice. That brings us to item number 15, House Bill 0946. You're recognized. You have a motion and a second.
And we do have an amendment on this bill that makes the bill, it has an abysmally small number, which is 5468.
Okay. We have a motion and a second on that amendment. Rewrites the bill. Would you like us to put that in before
Sure,
discussion?
yes, sir. That'd be fine.
Okay. All those in favor of amendment, putting amendment 5468 on the bill, say aye. Opposed? Ayes have it. You are on the bill as amended.
Yes, sir. Thank you, ladies and gentlemen. This bill 946 as amended will update current public health policy concerning prevention and treatment of STDs. Our state has long maintained a comprehensive program in place to address the continued problem of STDs in adults and teens. I want to quote our illustrious member, Dr. Kumar, when he was naming off all these dangerous activities and sex. You know, it is not for minors. So I just am reflecting your voice, sir. The program, the mission of the programs that we've had in the state is to prevent, control, and treat the spread of sexually transmitted diseases, STDs, in Tennessee. Nationwide, yearly, we had last year 20 million STDs newly diagnosed. Half of those patients were between the ages of 15 and 24. It caused that burden cost the health system approximately $16 billion. This is the sixth consecutive year that we've had recorded highs in new cases of STDs. So they've been going up for 6 years. Currently in code, and we're talking about probably 30 years old, currently in code, there's a specific subsection that establishes which providers may treat minors with STDs, including physicians and the advanced practice nurses under a physician's supervision. Any state, district, county, or municipal health officer may treat minors with STDs. Currently, the law reads, healthcare officers and providers licensed in the state under what I just had referenced may examine, diagnose, and treat minors infected with STDs. In the House Bill 946 is amended, will update the current public health policy that I just referenced, allowing consultation by public health officers along with physicians on preventing the prevention of STDs. What that will do, the bill does not expand the scope of practice for healthcare professionals. It never included dentist, and by code, it cannot include dentist in that portion. It does not allow distribution of birth control pills because by definition, birth control pills have nothing to do with controlling STDs. It is not an attempt to circumvent laws validating parental rights, which have been in place for 30 years. This bill, as amended, is not tied to a bill allowing dentists in any way to give vaccinations, and never was intended for that. The bill was actually filed in February 2021, and it was never. I've been accused of being influenced by pharmaceutical companies. The bill was not introduced on behalf of a drug company, and who brought us the bill was a Tennessee Charitable Care Network, a 501c3 nonprofit coalition. So the current law, as I have said and mentioned, the fact is that for 30 years, the current law has allowed minors to be treated for STDs by public health officials, doctors, nurse practitioners, and all those folks that I had mentioned previously listed in code. These healthcare professionals provide consultation on how to avoid sexually transmitted diseases. This is a common sense bill that's been misinterpreted for fundraising purposes by groups outside the state. And I want to mention the prevention. These providers that are taking care of these folks, because of the 6 or 8 words that are missing from code, cannot by law address these preventive measures. Preventive measures as innocent as practicing abstinence. That's a preventive measure, and it's not in this piece of code. Use of condoms, having fewer partners, getting tested for STDs, talking with partners about that. So
No, I didn't. Mine got cut off too. It wasn't me.
It happens all the time. And I'm so sorry to be lengthy, but I'm trying to address the confusing issues that have come up about this bill when at the basic nature of the bill is to add the ability of these providers, as I have discussed in code, to be able to discuss prevention and be within lawful ability for counseling on these preventive type measures. As I say, this new language says that healthcare officers and providers, as I've mentioned in code, licensed in this state may examine, diagnose, or treat a minor infected with STDs, or, and this is the new portion of the code that's added to it, provide consultation, examination, diagnosis, or treatment to a minor to prevent STDs. This does not address any code for vaccination, only counseling. The truth is, we don't want to have to think about young people related to the treatment or prevention of STDs, but being able to provide consultation and prevention should move us toward treating fewer and fewer of them, and that's the goal. With that explanation and pending questions, sir, I would renew the motion.
All right, thank you. We have some people here that are to testify, and I don't know how much longer they were going to allow us to go into the next committee. So without objection, let's have them come up here just real quick to say a few words, but I don't know how much time we're going to have for this. So without objection, we'll go out of session. If you can give us your name and give us 3 minutes and who you're with.
Thank you, Mr. Chairman and committee members. My name is Eileen Iorio. I am a research assistant for Children's Health Defense and co-author of the book HPV Vaccine on Trial. The preface of our book was written by virologist and Nobel Prize winner, the late Luc Montagnier. I have 3 children attending schools in Brentwood. I'm here today to testify against House Bill 946, which will allow certain healthcare providers to provide treatment for the prevention of sexually transmitted diseases to minors without parental consent. The bill is written with a hidden intention, and I understand that this wasn't mentioned, but we believe it was written with the hidden intention to include the HPV vaccine. That is not excluded in the code. It would also include any other vaccines indicated for the prevention of STDs in the future, as yet unapproved. It would also include controversial HIV prevention drugs, potentially, which pharmaceutical companies intend to push on high school students, regardless of their risk. Regarding vaccination of minors without parental consent, I object to this bill on the following grounds. It contravenes federal law. It would put children at risk as adverse events may go unchecked, and there is a risk of duplicate vaccination by other medical providers if a parent is not aware. It undermines parental rights and encourages children to deceive their parents. On the federal law issue, the National Childhood Vaccine Injury Act of 1986 gives blanket product immunity to vaccine manufacturers. This law explicitly states the parents or guardians must be given information both before and after vaccination, and the CDC gives clear guidance for such. The reason is that if there is a vaccine reaction, then the parent is solely responsible because the vaccine manufacturers have been given liability against injury and death. Merck, the manufacturer, makes over $5.6 billion in sales on this vaccine, and yet it is not responsible for any adverse outcome, except in the case of fraud, which I can mention later. So it is incumbent on lawmakers to be aware of the parent or guardian's responsibility to the child.
Ma'am?
Yes.
I'm sorry,
thank
I'm
you.
going to have to interrupt you here. If the other folks that are up here can just briefly tell us your name and who you're with.
Thank you.
I've been informed by the clerk that we're not going to be able to take action on this bill today. We've got another committee in here, so if you can please
I
briefly tell us who
appreciate your
you're
time.
with.
Thank you. Karen.
Karen England, Capital Resource Institute, Parental Rights Council, and we may be based in California, but I live here and have lived here for 2 years. I've not fundraised a dime off our opposition to HPV
Just who
vaccines
you are
without
and just who
parents.
you are, ma'am. Who you are and who you're with.
I'm Jalen Farmer, and I'm here with Miss Bernadette.
Thank you.
Thank you.
I'm Rolf Hazelhurst. I'm an attorney.
Need turn on your mic, please.
I'm Rolf Hazelhurst. I'm an attorney from Jackson. I work for Children's Health Defense. I'm the father of a vaccine injured child.
Thank you.
Is it on? My name is
Yes.
Kimberly Calcode. I'm a mom of 4 in Williamson County.
Thank you. Appreciate you guys. Submit your testimony. We will be back next week. Now that everybody in the committees know your names, look for that email. Without objection, we'll go back in session. My apologies to the sponsor of this bill and to those that came here to speak. I thought that we would be able to get to all this on time today, but we will be back next week. So without objection, we are adjourned.